have to continue CPR for 5 cycles and reassess. Shockable or unshockable. For advanced life support on the AMS, let them take over the transfer the victim to the hospital for advanced care. And the ambulance is a small hospital. The advanced start from the ambulance. They have oxygen, they have drugs, and they have advanced airway management. So you can treat the patient as in the hospital in the ambulance. Return to spontaneous circulation, comprehensive, multidisciplinary system of care including mind, therapeutic, hypothermia, and other treatment. You get? Okay. Chain of survival in hospital. So, what do you do in the first? Prevent and recognize cardiac arrest. You have to monitor. That means the patient outside hospital is not possible. It's not anticipated to have cardiac arrest. Am I right? But in the hospital, we anticipate because they have cardiac problem. They have electrolyte imbalance. Something that you have to imagine that this patient can get cardiac arrest. So we have to observe and prevent cardiac arrest in hospital. So if there is cardiac arrest, you have to activate. Activate what? Ambulance? Code blue. We have a special team for resuscitation. So you have to activate the code blue team. And the first one, they are going to start chest compression. You will be the first responder, and they will start CPR early. What's the next? Prevent, observe, prevent cardiac arrest, activate code blue, start early CPR, and shock. In shock, we have manual, it's not automated. Outside hospital, we have an AED machine, and AED is automated machine. In the hospital, you have to read them and analyze the reason, and according to the analysis, you can give manual shock. Okay? What's the next? Continue care as advanced cardiac care and recovery for cardiac. What can I mention the in-hospital and on-hospital? Hello, Mom.
Hello, sir.
Outside hospital, how many, please?
I'm still sleeping.
Yes.
Sabi ko, first ako, first talaga.
Outside, how many gym?
Yeah. 6.
Outside?
6.
Outside? Outside? Five?
Yeah. So first,
Recognition.
and
Then CPR.
like call. Recognize, then call for emergency. The number is 911.
911.
Excellent. Next.
Next CPR.
Next.
Next
Air CPR.
defibrillator.
Defibrillator. Excellent. How many? 3.
Then post care.
No.
Post recovery care. And
Ambulance. The car.
Car.
Outside hospital, we have the ambulance because you need to transfer the patient from outside to inside facility.
معلش تاني بس.
So first, recognize. How you recognize? 3. You have to check for response, tap over the shoulder, and you have to check for pulse and breathing for the same time. You know that maximum time to check for response and check for pulse breathing is 10 seconds. You have to minimize interruption while you are doing the assessment. And the next, you have to start early CPR after the call for emergency and shock the patient if you have the machine. If you don't have the machine, continue CPR and waiting for the machine. You have the 3. This is 3. The other 3 is ambulance, post-cardiac, recovery. Ambulance, post-cardiac, and recovery. So we're going to mention the in-hospital. Hello, sir.
Supervision.
Observe and prevent cardiac arrest and
CPR. CPR.
CPR.
And good
Okay, for in hospital, you have to observe,
Observe.
prevent cardiac arrest, and
Conserve cold blue team.
call for call blue team because this is special team for resuscitation and start early CPR on your shock and post cardiac care and recovery. Yeah, it's very important to follow these sequences of chain of sequence. Okay, here we have to the adult CPR rescue. At the end, the objective recognize the sign of cardiac arrest, and we mentioned that. How do you know that this patient needs for CPR?
No breathing.
No breathing.
Pulseless.
And how to check for breathing? You look for the chest. If the chest rise and fall, that means. Or you can look, listen, and feel. Look for the chest, listen, and feel for breathing. Within 5 to 10 seconds, if there is no breathing, no pulse, you have to start the CPR. And by the way, how you check for pulse for adult?
Carotid artery.
Where we find the adult, carotid?
There is a space between sternum
There is sternomastoid and the trachea, the midline. Press 2 fingers and feel the pulse. The time allowed is 5 to 10 seconds. Okay. And how to perform effective chest compression for adult and single rescue. For 1 or 2 rescue, you have to deliver 30 and 2 chest compression. All right. As we mentioned before that we have 3 for high quality chest compression. What is it? The depth of chest compression is 2 inch, 5 centimeters. And the chest recoil, you have to go back to the same chest recoil. And this is why, because when you push down, you have to allow for refill. Unless you take care of your weight, you cannot refill the chamber again. So you have to brace, allow refill. And don't be fast. You have to be between 100 120 per minute. Okay, so that means per second, how many chest compression? Per second. 2. The maximum 2, because we have per minute 100 to 120. 2 times 60 is 120. Right? So don't be very fast. More than 10, 20, you cannot refill the chest. Okay. So explain how to open the airway. This is for the ventilation. How we open the airway for non-traumatic patient. Any shots here? How to open? Okay, you have to. Okay.
And chill. Like this.
This is by your hand. How you apply the mask while you are open the airway. Seal the mask.
Open the nose.
The mask. For the mask. No. Here you have to seal and cover the nose mouth. And seal the mask, C and E. And by 3 fingers E, you have to open the airway. Give and look for chest rise and fall while you are doing it. For each press, you have 1 second. Don't do it very fast. This is absolutely wrong. So 1 and 2, stop, and 3. So you can give. The maximum time for ventilation is 10 seconds. If you exceed 10 seconds, this is through interruption. You interrupt chest compression. You interrupt perfusions, you have to go back. And that means you have to do it practice ventilation, not to interrupt chest compression. If you do it well practice, you can continue within 10 seconds, less than 10 seconds. Okay? So here you have to look for oxygen concentration. This is the mask. If you are out hospital, you have so many devices to use to give oxygen or ventilation. The bag mask is BVM. It's delivered 21 atmospheric or room concentration. So how can we add more oxygen concentration? You have to connect with oxygen. Am I right? You have to put an oxygen or reserve bag. If you put reserve bag, you can get 90 to 100%. So if you don't have mouth-to-mouth, or if you don't have the bag mask, you have to use mouth-to-mouth ventilation. So what do you have? We have pocket mask. Here we have the filter. We have the mouthpiece. This is disposable. Okay, so you have to seal and seal your mask, open the airway, and give to this breeze until you see the chest area. Okay? So, what do you do? We're going to start CPR. The first step is check for safety. Second step, check for response. Say, are you okay? If there is no response, call for help. Check for pulse and breathing. From 5 to 1 and 2 and 3 and 4 and 5 and 6. There is no breathing, no pulse. Activate the MS 911 and start CPR. The correct hand position is the lower half of the chest bone. You have to protect the exploit process. Don't break it. Huh? Put the heel of your hand, the heel, not the palm, the heel of your hand. The fingers push out, pass it out. 1, 2, 3, 4, 5, 6, 7. Again, 30. Okay. Hold the back. Within 10 seconds, 1 and 2 and 3 and 4 and 6. Within 6 seconds, give way and go back forth. How many cycles? 5 cycles. After 5, you have to reassess pulse, breathing, and response. Hello, Mom. Yes, you can do it.
No.
Show me how to deliver adult CPR. Yes. Yes, Mom. Yes, can you? Let's go.
I'm still sleeping.
Sleeping. One by one. Yes, come here.
Sit first.
Yes, step up. No, doctor. What's the first step? You have to go step by step. What's the first step? Still safety. Safety and check for response. No. Check for response. Tap over the shoulder. أضرب على الكتف. Say, are you okay? There is no response. Call for help. Check for pulse breathing. In your side. 2 fingers. Right here. And I count. 1 and 2 and 3 and 4 and 5 and 6. If you don't feel and there is no pulse, no breathing, at that time call for emergency 911 and start chest compression. The correct position is the heel of your hand in the lower half. Protect the exploit process. Push by your waist, don't use your hand. Count, doctor. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Get your skill breeze within 10 seconds. Hurry. 1 and 2. No, breathing. Ventilation. 1 and 2. Open the airway. No. Head up. Look for the chest. Give 1. If you see the chest right, that means you give ventilation. How many breaths you have? Only 2. Okay, so how many cycles retrieval? 5 cycles of compression and to respiration. This is equal to 2 minutes actually. After 2 minutes, go and reassess. Pulse, breathing, and response. Hello. Next, please. Yes. First step.
Are you tracing? Then I check the
How many seconds you check?
1, 2, 3, 4, 5, 6, 7.
There is no pulse. Don't waste your time. If there is no within 6, within 5, there is no pulse, you have to start call for emergency. The number is
991.
911 and start the CPR. If there is bystander, another one, ask your friend to call for emergency and you have to be busy by for your patient. Do it. 1. More deaths?
Four.
More deaths?
Uh,
The death 5
5
seconds.
centimeters.
More deaths? And if you press 5, you have to go release 5. Up. 5. Go back, release.
Yeah, for what? For 10
To
minutes?
release
For 10 seconds?
30 cycle, 30 chest compression. Right, so stop. Finish, give your speed. Within 10, 1 and 2, open the airway, head up, 3, 5, look for the chest. The chest rise, excellent. Only 2.
Only 2?
Only 2.
Stay.
And continue for 5 sets. And after 5 cycles, you have to reassess. There is pulse, there is breathing, recovery position, the patient is okay. If there is no response, no breathing, you have to give another 5 cycles, 2 minutes CPR. But you have to consider the reversible cause, the underlying cause. Sometimes the patient is old, they have hypoglycemia, so you have to treat it. If you suspect this patient hypoglycemic, you have to treat hypoglycemia and go back to CPR. If the patient is hypoxic, there is block of the airway, you have to maintain airway open and continue CPR.
Excuse me. My finger puts here. Here.
You feel it?
Down.
You feel it?
I'm a little.
You feel it, huh?
Yes,
Wait. Calm down.
yes.
You feel it?
Yes.
That means you have pulsation. So the problem is it's possible to check in the other side on your side. This is practical point. If you check, you have to check in your side. Don't check here because you see as you kill the patient, you block the airway. So you have to check in your side. Press 1 and 2 and 3 and 4 and 5. There is no pulse. You have to start everything. Next, please. This is not evaluation. This is only to test yourself. The evaluation, you have to use the program. They record and evaluate your performance. First step, mom.
Tap the patient.
No. Safety first. Hello.
Are you okay?
Look around, smell, listen for abnormal sound. This scene is not safe. Don't enter the scene. Either to call for emergency or civil defense to save the patient, or you can take the patient to safety.
Oh,
Okay.
no,
Next, check for response.
Are you okay? Then check the pulse here.
No response. You can call for help. Scream. Your neighbor, maybe doctor or nurse, you can ask for help. Check for pulse within 5 to 10 seconds. There is no pulse. What do you do? Again. Again. First step. No. First step.
Tap the patient.
No, same thing.
I say,
Yalla.
okay. Tap the patient.
And no. Call for help.
Call for help.
Help me. We have patient falls out. Help me. That time you have to check for pulse and ask your neighbor to call for help.
Okay.
Again.
Ito
Talaga nawawala na ako.
Tutu dan kita. How do you? Safety.
safety. Then
How check for safety?
I will see the
Look around,
look around.
listen and see. Okay. Next, check for response. Tap over the shoulder.
Tap the shoulder. Then
For help.
call for help.
Check for pulse.
Check for pulse.
If there is no pulse and breathing, look for the chest. While you check for the pulse, look for the chest. The chest doesn't rise, that means there is no breathing. Come down, please. Please keep silent. Okay. Next, call for emergency. The number is
911.
and start CPR. How many chest compression?
10.
30.
30, but
High quality CPR. We have depth 5, chest recoil, and speed 100 to 100. That means per second we have maximum 2 chest compression. You can do it? Okay, do it. Push one hard fast. 1, 2, count.
3, 4, 5,
Fast, faster, faster.
7, 8, 9, 10. And then
Another
1, 2,
until 30.
3, 4, 5, 6, 7, 8, 9, 10. Then I will check them.
No. Don't check between cycles. 5
5
cycles.
seconds.
You finish 2 minutes, at that time you can
Then I
reassess.
can reassess.
Okay, ventilation. 1 within 10 seconds. 1 and 2. Give ventilation. See the mask. Your hand should be here.
And here.
Okay. See the mask.
See the
Open
mask.
their way. Look for the chest.
And then I will
Give. Open their way. 1 and 2. Excellent. Very good. How many? 2.
2.
Okay. How many cycles?
5 seconds.
5 cycles. After 5 cycles,
No breathing.
if no breathing, no response, repeat another 5 cycles. If there is pulse breathing, response,
Hold down.
recovery position. You have to put it in the left lateral position. What's the benefit of lateral position? You prevent aspiration and you can maintain the airway by displacement of the tongue away from the glottis. Because if the pressure is in the supine and he is unresponsive or he is semi-conscious, the air will be blocked by the tongue. So if you get the lateral side, you can prevent obstruction and enhance ventilation.
Left lateral.
Left lateral. Next, please.
Check the thorax around.
Okay,
Okay. Then check for the responsiveness of the patient.
do it.
Racer, are you okay?
No response.
No response.
Help.
Ask for help.
Okay.
And then we'll check the
No pulse
and the
within
breathing.
10 seconds.
Within 10
5 to
seconds.
10.
No pulse, no breathing.
While you check, your eyes should be look for the chest. Look, the chest rise or not for.
Movement.
Okay?
There's
Okay.
no pulse, no breathing.
Call for
So
emergency.
I will activate EMS.
Okay.
Call 911 and I will start CPR.
Okay. Push hard, push fast without interruption. This is chest compression depth 5. Chest release 100 to 100 per minute. Count loud.
18, 19, 20, 21,
دكتور هي بالنسبه للبي ال اس
26, 27.
دي العامل الشعبي مش لازم الستاف الطبي نفسه.
ده
يعني
ماشي.
ممكن فالبلس دوت ممكن واحد عادي ما يعرفش يقول.
ده احنا في lay person you cannot advise them to check for the pulse. Just look for the chest. If there is no
مش
breathing.
شرط الستاف الطبي هو اللي يعمل الحاجات دي. يعني ممكن الناس العاديه
ايوه اذا lay person ما شرط تشيك على البلس.
آه.
شيك على التنفس.
نشوف بس حد
اذا ما في تنفس يبدا سيبيار. No, let him to do it. No, ma'am.
No, I will try. I will try because a while ago I did not put. Right.
You will not be there if he have a CPR. Maybe he's alone, huh? So let him to practice. Give. Okay. Look open the airway. Look for the chest. Excellent here. How many cycles?
5 cycles.
After 5.
Reassess the patient, and if there's no return of breathing, start the CPR.
Okay. Thank you.
Can I try again? But why I
Hello.
didn't put away
مع 5 سايكلز بعدين لو observe البلس
Pulse breathing or response.
I did.
Come on,
في ريسبونس يبقى
if there is response, there is pulse and breathing is okay.
put the patient in the
Lateral.
lateral position.
Will be the next. First day, mom. First day. Your name, Linka.
Safety.
Okay.
Check patient response.
Okay.
Are you okay? Check the pulse.
No. If there is no response, ask for help. Help. Check for pulse.
1, 2,
2 finger only. 2
1,
finger.
2,
Press down.
5.
Okay, there is no pulse, no
There is
breathing.
no pulse. Activate EMS.
Again, check for pulse and your eyes in the chest.
Chest.
Do it again. Check your eyes in the chest.
Okay. 1, 2, 3, 4, 5. There is no pulse, no breathe. Activate EMS.
Or ask somebody to activate.
911.
Or ask somebody to activate. The number is 91.
911.
Excellent. Go ahead. Hello. What is the correct hand position?
Other right.
Above expired process. Don't
Yeah.
press here because if you break it, you can make paratrauma. You have to cover by 2 fingers here. 2 fingers. Put the left hand here, the hip. Interlace with the other. Push fast and hard and fast.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Slow down, you are too fast. Slow down. 1.
30,
Yes.
40, 50, 60,
More
70,
speed, increase speed, more speed, more speed, faster, faster. Hello. Do it faster.
1, 2, 3, 4, 5, 6, 7.
So you have to adjust your speed of compression. If you don't have adjustment, you can do it very fast or very slow. So you have to be between 100 120. Keep ventilation. 1 and 2 and 3. Seal the mask, open the airway. Look for the chest rise while you are doing ventilation. No, open the airway. Give. No. This finger should be here. Yes, give. 1 and 2. Excellent. How many seconds?
5 seconds.
After 5,
The-
check for pulse, breathing, and the patient is conscious, is spontaneous. You have to put in the left lateral. Okay. So here, this is the time for evaluation. You have to evaluate your performance. Maybe not all the participants with chest compression, but it's clear that you can do chest compression and ventilation. All right?
Yes.
So the question, how to evaluate the performance? How can you evaluate? Am I right or wrong? If you have a real patient and you see. First, if you have a team work, you have to discuss why you are doing chest compression or ventilation. Because sometimes there is someone possible he didn't have the course maybe before 5 or 6 years. He didn't have the protocol or the rules. We have participants, they came to the course, I said 15-2 for adult. There is no 15-2. For adult, if it is 1 riskier, 2 riskier, it will be 32. This is for infant. If you have 2 riskier with infant, you can do 15 and 2 riskier. So you have to updating your team why you are doing and discuss why you are doing.
For infant, if 1 risk of
32. For 2, you have to. So after you finish, am I right? Is the depth size? Is the chest requires okay? Is the hour speed is okay? That means you have to evaluate it. Here we have, you have to take the cable and hello. Yes. So please, you can press on the chest. Press. Press. Only one. Yes. You heard the sound?
Yeah.
Okay. So if you look here, we have the compression evaluation here. You have the depth 5 and the release is 5. Okay? And this is for the speed of compression. You have to adapt yourself for the speed between 100 to 100. If you do it very fast, the program will announce you are very fast. So you have to slow. Okay? So let us do to see the test. 1, 2, 3, 4, 5. You see the depth 5 and chest release. The speed of compression is between 100 to 120. It goes very fast, you see here. You have a lamp that you are too fast. How you can do it from here? Because you are too fast. Let's do it. Yes. Okay. So now he's right because the speed of compression is okay and the depth is okay, just recoil is okay.
محتاج خبرة برضه.
But if you get here the score more than 80% or 90%, you can do it in the real very okay. So let us go examine the ventilation. For ventilation, we have either we have good ventilation or we have low. That means the volume of ventilation is very low. Or you can do it hyper ventilation, high volume. You can see here. You can give rate. Sometimes you can get rate color, that means you get high volume.
طب هايبر فنتوليشن في مشكلة دي يعني؟
Yes. What is the consequence of hyperventilation? You can get abdominal distension.
مم.
You can change the acid base. It will be alkalosis, respiratory. So you need to change it to.
والله ينفع بس يعني مفيش أبوظ من كده يعني.
Okay. So what do? You have to press. Half of the mask is enough. Give you 500, 600 milli. The half is enough. Don't press over. You can get more ventilation. Okay? High volume. Okay. Here, if you get 2 minutes, 5 seconds, CPR. After that, you can get evaluation. We have 3 areas of evaluation. Just compression, ventilation, and time. Very important the time. Because if you take more time for interruption, your score will be down. Okay? So let us to examine. If you give 1 minute, you have 2 cycles and a half. Okay? So just look for me while you are doing. Hello. You have to start session. Here, if you stop, you can start the evaluation. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. First score is 1 and 2 and 3. Go back for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1 and 2 and 3. Go back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. Finish time. Okay. So our score here is 100%. But we have 3 areas for evaluation in details. Here for chest compression. What about depth? Good depth, 100%. What about release? 100%. We have around 109 chest compression per minute. The speed is 100%. So the indicator in the middle, between 100 to 100%. Okay, for ventilation, we have 4 good volume. We have 0 volume high and low volume 0. The range, the ratio is 32. That means you have to account exactly 30 compression. Okay, for time, we spent 49 for chest compression. This is the time for chest compression. Is it important or not? You have to maximize the time for chest compression. Because once you do chest compression, that means you push the oxygen and plus circulation separate. So you spend most of your time for chest compression. If you exceed more than 49 per minute, it's okay. If you look for interruption per cycle, you have 5 seconds. What's the maximum? 10 seconds. If you exceed 10 seconds, this is true interruption. So you have to be at least less than 10 seconds. And then you have to divide the time of chest compression to the total time. 49 and 30 percent will be 80%, 82%. This is what we call it compression fraction. Compression fraction, you have to count the time, chest compression and the total time. Okay, we'll be the first.
Ayun na si Dr. ulit.
Be the first. Yes, come here. So first you have to test yourself, do chest compression, and look. If you have any redness here, that means you are wrong. Okay? Yes. Chest compression, test yourself before evaluation. No, test, only test. You have to fast, slow down, slow. You are too fast. You see here, this is clear. That means the skill of chest compression is not okay. So this is the program will identify the weakness points of chest compression. You have to take care. Slow down. Give me السرعة. طيب خلينا بس دقيقة، خلينا نلف هذه. معلش عشان تكون مواجهة للشاشة تقدر تشوف. طيب الحين هتحط ايش؟ هتشوف الشاشة إذا كان السرعة زايدة تقدر تعمل adjustment.
هو يبين من ناحية ايش؟
يبين لك انت الحين اضغطي قبل الضغط. 1 2 3 yes do it. So here the depth chest recoil is okay. But here it's low speed of compression, more speed. هذه هنا يكون في الوسط، لا هنا high speed.
دقيقة.
هي يكون في الوسط.
لحظة.
In the middle that means you are in between 100 to 100 per minute. مؤشر يلعب معناها انت ما وصل. لازم تضبط هذا.
شوف أنا يدي ترى صغيرة. يمكن هذا السبب.
ما له علاقة.
طيب واحد.
هذا ريزم انت بتحط ريزم 1 2 3 لا خليك معي 1 2 3 4 5 6 7 8 more depth. طلعت حاجة جديدة. This is the depth not 5. yes. More depth.
دقيقة.
More depth. You have to feel that you have adequate depth and chest required. Press 5, go back. Where are Next, please. It's not evaluation, huh?
لا أصلا أنا دايما ما أخلص بحس.
Okay.
I will begin.
Yes. You have to correct your position. The lower half of the chest bone. Do it fast. Slow down. Look for indicator.
Again?
Yes. Slow down. Slow.
9, 10. Another?
More.
1.
Okay. Give ventilation. The ventilation should be medium. No high volume or no low volume.
1.
Okay. Open the airway. Head up. Head tilt chin. Yes.
1.
Don't press fast. Within 1 second. 1 and 2. Stop and 3. Excellent. So gonna we start the evaluation? Where are you?
Hindi pa ba natapos?
Yeah, you have to get percent. Do it. Yes.
Okay, I will try.
Yes.
1, 2, 3, 4, 5, 6, 7.
Slow down. No, continue. Don't stop.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Ventilation. Here we have the interruption time. You see here 3, 4. You should give. One. Go back. Chest compression. This is still interruption. Yes,
One.
the maximum time is 10 seconds.
7, 8, 9,
Slow down.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Go back ventilation. One. Give ventilation. Fast.
1, 2.
Go back. Yes.
Again, bakit hindi matapos-tapos?
Finish time. This is the real evaluation for the time. The score is 47, 74. If you look here, we have 25 interruption. Per cycle, you have 13 seconds, more than 10 seconds. Because exceed the time for ventilation and you look for me, and you look for the other. So don't interrupt your chest compression, okay? Here the speed is 55%. So you have failure 50% around. And your depth is okay, 98. Here is good. 97, the total score for compression. For ventilation, you give 6. You have to give only 4. So here the ratio is 31 to 3. Should be 30 to 2. So this is not correct here. Here the patient is firm. The maximum should be between 60 to 80% the compression fraction. The time of chest compression to the total time. So if you divide it 35 to 60 seconds will be 58. 50 is not good for the patient. That means you have more interruption. That means the perfusion is not okay. You get breathless. So if you repeat this cycle like this, you lose your patient. But it's good. 74. We need more practice. Okay. Next, please. Next. Yes, Sanhayo. Yes, compression. Yes, do it. Excellent. Very good. Okay, give ventilation within 10 seconds. Open the airway. No. You have to give more volume. Open the airway. No. Don't kill the patient. Seal. Open. Yes, this is more volume. More.
No, you have seal
With the mask, the fingers should be here. Yes. Give. Yes, here we are. Excellent. Very good. So we can start. Yes, do it. Do it. 1, 2, 3, 4. Count.
5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Excellent. Very good.
3,
Excellent.
4, 5, 6,
You are.
7, 8, 9, 10.
Go. Interruption. 3, 4. Go back. Chest. Go. Chest. 1, 2.
3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4.
As possible, you have to minimize interruption.
8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Excellent. Go back. Go. Chest compression.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9.
Finish now. Your question is passed. Sorry. First, you have to discuss Your score is 28, you have to repeat it. What's the problem? The problem is here. The pause time is more than the time of compression. You have 33 seconds, you have 11 per cycle, 33 seconds, and you have 27 only for chest compression. It is enough. 33 will be here and 27 will be here. So for the next, you have to repeat. Huh? This is score. If you have 45 compression time, compression fraction, that means it's not okay. But here the depth, just record is okay, the speed of compression, ventilation, everything. But here you have, sometimes you just compression very well, ventilation very well, but you have more interruption. If you have interruption, you interrupt just compression, that means you have 20. Next, please. No, chest compression first. CAB. You have to start with chest compression, airway, and ventilation. Look for the screen. Yes, do it. Slow down. Then you have to release your weight after chest compression. So press, release. This is the around for refill. Don't make fracture, huh? Ventilation. Okay. Excellent. So you have to start. Chest compression 30, 2 breaths. Count. Excellent, excellent. You are. So good, very good. Give ventilation. Within 10, 1 and 2. Go back. 1, 2, 3. Excellent. Go back. Go back, yes. Excellent. Slow down. Excellent. 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 Very good. If you look for the screen, you have the chest compression 100, release 98, and 113 chest compression per minute, and 98% per. This is exactly you have 32 because she's a count. It was a count very good. Okay? Good volume. 4 prices, you have 100% ventilation. For CCF, you have 14 only. You see the time here? The time of compression is more than interruption. This is the real CPR. Huh? Here we have CCF is 77. Less than 10 seconds. And now in the come 7 ثواني. Less than 10. Okay. If it's more than 10, you will be in dangerous. Next, please. You have to take photo. What?
عايز اطور يعني باور.
عايز جوه؟
يبغى لها جوه.
ايوه لازم يصير جوه. Next, please. You have to test. Look for the screen. Slow down, slow down, slow down. You are very fast. Hello. Hello. Slow down. شوي. 1 second to chest compression is maximum. Correct your position above. Don't press abdomen. Press abdomen. Here. Yes. 1, 2, slow down, slow. Indicate the rear in the middle. Slow, Slow. Slow, mom. Slow. 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 Good ventilation. No. C and E. No. This is here. This is here. See here. Yes. Look for the chest. Okay. So we have to start evaluation. Go ahead. Count. No, this is fine. Okay, do it. Slow down. Slow. Go for ventilation. Give two. Hurry. You see the interruption? Give. 1 and 2. Go back. Chest. Sustain. Interruption. Go. Chest compression. Count. Slow. Slow, mom. Slow. Don't do it fast. You have to be in between. Do it. Don't stop. Give ventilation. ودي لك كوفي ولا شيء. Can you repeat another cycle? It's very good. See, the speed you have 40%, you have 6%, you are very fast. That means there is no time for refill. Don't be fast. Slow down. Yes. Start. Slow down. Slow down. It's very 30, give to risky breeze. This is why we're running this program to just see we have to identify the weakness point. It's not good. You will be less than the before. Do it, continue.
أنا الدكتور بتاعها أخصائي طوارئ.
It's okay, but still you need more. You see the time here for interruption, you have 20 seconds, it's okay. But for their cycle, you have 14 seconds. So you have more than 10-second interruption. It's not good. It should be less than 10 seconds. And for ventilation, for chest compression, you have 53. You have double cycle. You give tea without sugar, huh? You have to do chest compression and to respirate. So you have to repeat, huh? You have to repeat this. But you are good here for chest compression. You have 95%, and you have to 90 for chest release. Here for compression is good, but the programs give you for total is 59%, 60%. Next, please. Next. Hold on, slowly, huh? Don't be fast. Look for the screen. 1, 2, 3. More, faster. Okay. ventilate. CNA. 1. Excellent. Very good. This is adequate ventilation. You can start evaluation. Session will start. 1, 2, count.
4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Ventilation. Corruption. Go back. Excellent. Very good. Very good. Yes, yes, do it.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Excellent. Very good. Interruption. 1, 2. Go back. Excellent.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5.
Excellent. Very good. Excellent. 100%. Good instructor, huh? By the way, this is the first time you get 100%. Maybe before 1 year, there's no one get 100%. The maximum is 99.
Doon ka tayo picture.
Well, very good. Excellent. You see, here for chest compression 100%, 100%, 100% speed, very good. For the ratio 32 exactly, the volume 4 and 4. Here compression because you have maybe 2 or 3 seconds maximum. If it is 11, it will be more than 80%, but it's very good. See, the compression is compression fraction 78%. Very good. Thank you, sir. Next, please. Doctor, Mashallah. Okay, test yourself.
6.
كان عندي نسيت هنا
لا خلاص. If you have some problem, release your under fingers. Okay. Slow down. You are fast. Excellent. Give ventilation. 2. Look for the chest. 1 and 2. Excellent. Can we start session? Yes, you are. Count. 30.
1, 2, 3, 4, 5, 6, 7, 8, 9,
Release.
10. 1, 2, 3,
Slow.
4, 5, 6, 7,
Release. You have 2 problems here.
1, 2, 3,
Release your
5, 6, 7.
just release after compression. Release your weight. 1 and 2. Go back.
1, 2,
Take off your weight after compression.
6, 7, 8.
You see the problem here?
1,
It's less than 5.
3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4,
Excellent.
5, 6, 7, 8, 9, 10.
Excellent. Interruption. 3, 4. Excellent. Go back. Excellent.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Give ventilation. We finish. Excellent. 93%. Excellent. Very good. Here for you see here the weakness point, your chest release. You don't have good release because you get 65%. That means if you press 5, go release your weight. Don't press again, huh? Press, release, press, release. To run for refill. Your speed is 80%, good. For ventilation, 100%, 32, very good, excellent. 79, it's more than, it's excellent. You get 78, huh? She got 79, it's more than you. Even the score is less than you. But here the time is 13 and 47%. Because the interruption is less than 10 seconds. Very good. Can they give photo? Next, please. استجمعت القوى. Yes. So you can test. إذا بتتعب chest compression نبدأ evaluation على طول. اوكي. تعدي لازم تعدي. من 1 ل 30. لكن السرعة شوية. اكسلنت. ممتاز. ممتاز. قلل السرعة. اكسلنت. نرجع مرة ثانية سريع. قبل 10 ثواني ممتاز. لازم تعدي. سلو داون. قلل السرعة شوي. لا. خرج الهواء. ايوه. رجع سريع. 8 ثواني. قلل السرعة. خلي المارشل ب 100 ل 120. قلل السرعة. زيد السرعة شوية. خلي المارشل في الوسط. خلص الزمن. شوية مشكلة بالسرعة بس بسيط. 67 أو 76. عندك مشكلة في ايش؟ في السرعة يعني. لقيت 60% or ventilation is good 32 just compression 100% ventilation. See the interruption time here? have 25 هون تتأخر شوية. التأخير هذا مش كويس. لازم يكون أقل من كده. كل ما قللنا interruption هيزيد عندنا compression time. CCF is 58%. شوية والمرة الجاية زيد يمكن تصل ل 80 85 ل 90. تعبت مرة ثانية. شوف انت الأول كان ما عملت الأول صح؟ أول فيديو نكست. تقدر تصور إذا السكور بتاعك المرة الجاية. next. After we have to get break. Yes. No. Wait. Slow down. Slow.
Yes.
Right. What you are doing? Good? No. Okay, you have to start evaluation. Start. Count. Count. Okay, give ventilation. Give. One. No. Open the airway. Yes, do it. 1, 2. Go back. Chest compression. This more than 10 seconds. Welcome back. We're just going to revise the steps for other CPR. So what do we see? The first step, safety. You have to look around, environment. If the scene is not safe, you have to call for emergency or civil defense. Next step, you have to check for response, tap over the shoulder, and shout for help. There is no. Shout for help and ask for AD, because AD is the priority when they get the AD. The sequence of CPR is C, A, and B. If you get defibrillation, so the priority is for D. It will be D, C, A, and B. You get? Why is the priority is for D? Because alone, CPR is not the treatment, it's not the management. The management is the electrical shock. So if you get electrical shock, there is no need for CPR. If you don't have the machine, you have to continue CPR, but once you get the AD, you have to get the priority for defibrillation. You get? The question, if somebody continues CPR and get the machine, what do you do? One, continue CPR, and the other attach AD and shock the patient. Don't stop CPR and don't stop shock. Okay? You have to use both at the same time. Check for pulse, but not more than 10 seconds, 5 to 10, and activate the MS. And put the victim in recovery position if they get response. If there is pulse and breathing and response, lateral position. We mentioned that lateral position enhance ventilation and prevent aspiration. Get? Okay. The sequence of CPR. Assess continue if there is pulse without normal breathing. What do you do? If there is pulse without normal breathing, you have to give breathing every 6 seconds. How many breaths we have per minute? Every 6. Every 6 you get 10 per minute, 10 breaths. This in case there is pulse and there is no breathing. But you have to look why we get normal, why we don't have breathing. Look for the airway. If there is block, you have to open the airway. Okay, high quality CPR cardio. That means you have to follow the sequence of C, A, and B. Compression, airway, and ventilation. What do you mention high quality CPR? Yes?
You don't put me also.
Matalino. So high quality, the depth 5, and chest recoil, and speed 100 to 120 per minute. Do it hard, fast, without interruption. Maximum time for interruption is 10 seconds. Don't say 10 seconds. Okay, high quality, I would mention chest compression, normal breathing versus gasping. Okay, the location of, you see here, you have to protect the end of the sternum, the expired process, put the head of your hand in the lower half. If somebody asks you where the correct hand position is, lower half of the chest bone. The chest bone, the lower half. Put your head of your hand. Press by your weight should be vertical over the chest and your leg vertical over the ground. 90 degree. So what's happened if you get more less than 90 degree, you push by your arm. So you get easy fatigue. After 2 minutes, you fell down. You don't have power. So you have to push by your weight, not by your arm. So the depth, as I mentioned, 2 inches down and chest release. 2 inches, 5 centimeters, go back. This is what we call it, push and release. Push and release. And you have to be range between 100 to 120 to allow for refill. This is not good. What's wrong here? This should be depth, huh? Yes, here. This is a depth, not relaxation. Yes. Relaxation should be here, huh? So it's a versus. It's a depth 5 and release. Release here. Release here. Up. 2 inches. So chest recoil, depth and rate 100. This is a triangle. You can take the photo here. Very important. High quality CPR, the rate 100, 120, and the depth 2 inches and chest recoil after each chest compression. So if you mention high quality CPR, mean chest depth 5, chest compression rate 100, 120, and complete chest recoil after each chest compression. Automated external defibrillator. We have universal 4 steps. What the first steps? What do you mean by automated? Running automatically. And external, that means I use it external, the skin, not internal. Internal for open heart surgery. Yeah? And defibrillator is against fibrillation. We have 2 types, shockable and shockable. What is shockable? BF, defibrillation. Less beta. What is unshockable? Resistor or beer. What is beer? Beer. BEA. Pulseless electrical activity. So for the steps, pay attention. First step, power on. Second step, attach pad. 4 adults, 1 in the right side under the clavicle and the second in the left under the knee. This is for adult. For infant and child, we attach the pad back and front, the chest and the back, because we have a small chest. One in the chest and the other in the back. What about Joule? Actually, the machine
I will just keep it.
yes, bibigay ka lahat sa'yo.
Sa'yo na lahat.
Okay. What is the third step? First, power on. Second, attach pad. 3, allow for analysis of heart shockable or unshockable. The last one is shock the patient, but you have to clear your team before you shock the patient. Clear and shock the patient. Here you are. So first you have to operate on
adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest. Open packet and apply pads on the patient's bare skin. Press pads firmly on skin. Apply pads. Do not touch the patient. Analyzing heart rhythm.
analysis number 3.
Do not touch the patient. Analyzing heart rhythm.
Result.
Shock advised.
Shock advice. You can't continue.
Do not touch the patient. Everyone clear. Press the flashing shock button.
Everyone clear. 1 and 2
Press
and
the shock
3.
button. Shock delivered.
After shock,
Begin CPR.
5 seconds.
Ten. 20. 30. Give 2 breaths.
Waiting 10 seconds. 1 and 2 and 3. Go back. See, this is the machine. Huh? How many cycles? 5 cycles.
10. 20.
What is something after 5?
30. Give 2 breaths.
1 and 2 and 3. Third one, 32, 32. Well, after 5, the machine will go and stop CPR reanalysis. If there is shockable, give shock CPR 5 cycles. If there is no shock, continue CPR. Precaution. What is the precaution?
30. Give
If
2
there is
breaths.
water, you have to dry the chest. If there is hair chest in the main, you have to shave it. You have a rooster already on the machine. You can take it and shave.
10.
What about pacemaker? If you have a mounted pacemaker, don't apply over. You have to get away. Because you can destroy the machine, the device.
30. Give 2 breaths.
Just you have to listen for the result after 5. Is the last one?
10. 20. 30. Give 2 breaths. Stop CPR.
Stop.
Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. No shock advised. Begin CPR.
No shock advised, begin CPR. Is it clear? Can you shock the patient here in the water? This is underdrawing.
10.
Can you shock? What's happening if you shock? You shock all the team.
20.
So you have 1, 2, 3, 5 patients. Okay, you have to take it outside, you dry it, and shock the patient. Okay,
Replace batteries.
you can do it with the dressing.
Ayoko na, nahilo ako sa sigarilyo.
Dali na, bibidyoan.
Okay, we have sudden collapse 25 m on the ground. Collapse, what do you do? Come here.
Nawala na ako, nahilo ako sa sigarilyo.
You call your thing the first. What do? You have to start, check safety.
Again?
Yes. Safety. Machine is safe. Check for response.
For response. And then,
And
then,
help.
help.
Check for pulse. No pulse. No
pulse.
breathing within 5 to 10 seconds. Start chest compression. So and the ambulance. Yes, you have to start.
1, 2, 3.
So the AD is coming. How can you use the machine? First step, operate on. Yes, operate. Operate on the green one. Yes, continue chest compression. Continue.
If the patient is a child, press the child button.
Continue.
Remove clothing from the patient's chest.
Listen here.
Open packet and apply pads
No, continue and
on
listen.
their skin. Apply pads as
Apply
shown
pads.
in the pictures. Press pads firmly on skin.
No, nothing the
Apply
living.
pads
Upon
as
the
shown
bell of
in
the
the
living.
pictures.
Look here.
Apply pads as shown in the
Continue.
pictures. Press pads firmly on skin.
Look, listen.
Apply pads as shown in the pictures.
Like that. Press.
Apply pads as shown in the pictures.
Press.
Do not touch the patient
Don't touch.
analyzing
Don't
heart
touch.
rhythm.
Do it. During analysis, don't touch.
Do not touch the patient analyzing heart rhythm. Shock advised.
Short advice.
Do not touch the patient. Everyone clear.
Clear your team.
Press the flashing
Press
shock
one. Every two clear. 1, 2, 3.
Press
Press.
the shock button. Shock delivered. Begin CPR.
Yes. Yes.
10. 20. 30. Give 2 breaths.
Within 10 seconds, the interruption because we start again chest compression and she did not finish the
10.
ventilation. Go back, chest compression.
20. 30. Give 2 breaths.
Again, go back, chest compression.
10. 20.
How many seconds? 5.
Ayun.
Go back. Yes.
10, 20,
Pagod na.
30. Give 2 breaths.
Sige na ulit. Sige na. Bago na.
Pagod na ako.
10,
Stop.
20,
Your hand is incorrect.
give 2
I am
breaths.
tired already.
Two breaths.
Two breaths.
Stop. CPR.
Stop.
Touch the patient. Analyzing heart rhythm.
Result?
Do not touch the patient. Analyzing heart rhythm. No shock advised.
No shock. What do you do?
Begin
Check for
CPR.
pulse. If there is pulse, placing recovery position. There is no pulse, this is unshockable rhythm, you have to continue only CPR.
Wow.
Okay? If it is unshockable, only CPR and transfer the patient to hospital. Thank you, mom. It's difficult, huh? Put off.
30. Give 2
Put
breaths.
off.
Ayaw.
Okay, as we mentioned, if you have a implanted pacemaker like that, don't apply because you can destroy it and the patient may get radical. So you have to get away from the pacemaker. And don't apply over the nipple, huh? Because you can kill the patient, huh? Okay. Automated external special. If you have medical patch, you have to remove it and clean the area and attach the part. So if they have here, medical patch, pacemaker, you have to adjust this. If you have here, you have to shave it because the patch should not be sticky to the skin. To be stick totally to the skin. Okay, if you have two risks here for CPR, one doing chest compression and the other doing ventilation. So how many chest compression? 32. 32. 5 seconds, switch. Yeah, you have to do teamwork. Only 4 minutes, huh? Who will be the leader? Actually, we have 16 members. We have compressor, ventilator, and airway CPR course, who will do from the patient. What's the other 3? Leader, drug administration, and time record. We have 6. But we can get, who will be the leader?
Steven.
Steven.
Steven will be the leader.
Steven Harvey. Okay,
Sakit din kamay ko.
who will be the leader?
Sige natin. Para nagpakuhan ka na.
Kayo naman.
You left your hair, mom.
Sir?
You left your hair here.
Yeah, I saw it.
But I need a home. Okay, who will be the leader?
Steven will be the one.
Steven.
Mag-order ka rin naman namin.
You have to choose your team, one for compression, and the other for ventilation, and one for shock. And assign one for recording. Huh?
Okay na.
Okay.
Kala ko ba?
Who will be your compression?
Nag-leader niyo ako.
Compression.
Compressor. Ventilation.
Shockable for shock,
Atira.
and one for recording.
Recording na.
Recording na lang.
I am
You
done.
have to, how many seconds, how many?
I have to.
Check your paper. Okay. So you have to start by operate the machine. And if you shock the patient, start CPR to minimize interruption. Okay? Once it starts CPR, chest compression you have to start, but you have 4 minutes. How many cycles in 4 minutes? Every 2 you have 5.
Yes.
So you have 10. Okay?
Kaya mo
10
yun.
cycles. Between cycles, you have to switch 2 minutes, switch compressor and benzene. Okay? It's supposed to get more than 80% for performance. But you have to manage your team. This is your rule, huh?
Ibig sabihin mo kung
If
ano.
somebody do it very fast, very slow, ventilation is not good, you have to manage this. Okay. Get down more. Yes.
Adult patient. If the patient is a child, press the child button.
Speaker.
Remove clothing from the patient's chest. Open packet and apply pads on the patient's bare skin.
Under the
Press
clip.
pads firmly on skin. Apply pads as shown in the pictures. Do not touch
Stop.
the patient. Analyzing heart
Wait.
rhythm.
Clear your team. Everybody clear?
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing
Press
shock.
1, 2, 3.
Shock delivered. Begin CPR.
Stop. Stand by. Huh? After 30, give to repeat. You have to observe.
10,
Mom, you have to stop. This is the first cycle.
First.
20,
Bagal. Sakto.
30. Give 2 breaths.
Good. Sige, sakto lang.
10, 20, 30. Give 2 breaths.
Ang gawin, nahulog na tayo.
10,
After 2 minutes, stand by for the switch. How we switch should be clockwise, huh? Don't hit each other head, huh?
30. Give 2 breaths.
Go.
Excellent. Very good.
10,
Sige lang. Continue lang.
You have to prepare the compressor, the second one. Who will be switched?
30 seconds before.
Likewise.
Pagkat pa ka.
It is not good for chest
Give
compression.
2 breaths.
Yes.
This is a decision of the rule of the team leader.
Ang
If
demand.
he decide to switch with the
10,
CPR course, your role during compression is to observe the compressor. Don't sit alone. You have to observe the compressor.
30. Give 2 breaths.
Switch.
Nakapal na, di ba?
Stop CPR.
Switch, come
Do
here.
not touch the
Here.
Analyzing heart rhythm.
Okay? This is your rule.
Do not
Analyze.
touch the patient. Analyzing
Look for the
heart
machine.
rhythm. No shock advised. Begin CPR.
CPR.
Sige lang. Yung ano na compression niya. Release niya, release. Ayan. Good.
20,
Release.
Ano ang second?
6.
30. Give 2 breaths.
Good.
Excellent.
Go.
Put the mask. You have to keep the mask. This is immunizing interruptions. Because after surgery, if you took the mask from the ground, you say this is 2-3 seconds. So you have to keep the mask over the
20,
mouth of the face.
Very smooth.
30. Give 2 breaths.
8, 9.
Good. Pambali yan. Go.
Nasundin yan, bigyan ko bagal.
10,
Continue lang.
20,
How many seconds elapsed?
30 seconds.
Okay.
30. Give 2 breaths.
Go.
Excellent.
Tama. Tama yun.
Ay, bakit?
10, 20,
Good job. Excellent. Release.
Release.
30. Give 2 breaths.
Okay.
Go. Last one.
Go.
Last one. 10. 10
10,
seconds. 2, 1.
So at the end, the role of the leader and the time recorder will give reward for the rest of the group. Where is the
30.
weakness?
Give 2 breaths.
Excellent.
90.
Excellent. Very good. Very good. Okay, how to analyze
CPR. Do not
the
touch
result?
the
Use the team with the time recorder and give us the weakness point
Do not
and
touch the patient.
Okay.
Analyzing heart rhythm.
yes.
No shock
Tell
advised.
us what is the report.
Begin CPR.
Yes, 10 seconds. Okay. So show us the weakness. Chest compression, ventilation, and time. Put off now. Put off.
So our weakness for this.
There is no one here.
So our weakness
Yes,
is for
yes. The
the
depth.
the first one for compression, the release.
Yeah.
Because we just got
For both.
87%.
90,
87%.
87. So we have around 80% failure. For both, not for one.
Yes, for
Both they have not good release. Okay.
And the ventilation, we have a good volume of 18.
How many?
18.
Okay, we have 10 cycles. We're supposed to have, per cycle we have 2 press. Am I right? So 2 times 10 is 20. Am I right?
Yes, 20.
So we miss 2.
Yeah, but the our
18.
result is 100%.
Yes, it's 100, but
It should be 20.
it should be 20.
Okay, next
We
one.
miss 2.
And very good.
The ratio.
The ratio is
Down.
32.
72. So you are excellent.
Yes. And then the compression fraction 69%.
Should be more than 80, 82. But it's good. The per cycle interruption,
Interruption is 24.
24. It should be, the total interruption is 14 seconds. But really, this is the first time the team will get 98%. Really. So what do you think about communication? Very important. You have to communicate. There is no communication.
You do communication, but our
You have to communicate with CPR coach. How do you see the chest compression? Is it good? Yes, good. Oh, you have to emphasize. Very good. Excellent. Do it again. Oh, like that.
We didn't hear that, sir.
Because they are human beings. If you are sitting silent, you have to say, you can do it everything. Nobody will blame me. Huh?
Yes, sir.
So you have to encourage them. You are very good, excellent, do it again. Okay, more run. That's it. I'll give you money after this session.
it depends on the leader.
So, and you have to discuss. This is for the role of they are going to update in the team. Now we finish 2 cycles, we give 1 shock, and we have to switch after 30 seconds, for example. Okay? With the leader. And you have to share knowledge. Somebody they did not have how many chest compression, you have to update it. We have 30 per cycle and 2 rescue pacing for about 2 minutes. Here we have questions. Don't forget this. We have 2 types of CPR. We have interrupted and continuous CPR. For interrupted chest compression, you do 30 and 2 rescue pacing. Take Sada. مليت بسيط
أنا أصلا أخذتها بس إني قاعدة عشان الشهادة بدل.
عشان البطاقة. طيب during chest compression you are not allowed to give ventilation. Am I right? Can you ventilate during chest compression? Why? because the pressure will go to the stomach. So you are not allowed to give ventilation during 32 compression. 32. But if you have advanced airway, if the patient arrives to the hospital, we insert it in the trachea. Am I right? So how can you continue CPR at that time? Continuous without interruption. And ventilation every 6 seconds, give one respiration, only one. What's the benefits? There is no interruption time. Continuous compression and ventilation every 6. How many per minute? Every 6? 10. And for 32 5 seconds, how many breaths? 10. So per 2 minutes, 32 we have 10. And for 6 period ventilation we have 20. Because per minute you have 10. So 2 minutes you have 20. You have double ventilation because there is no interruption. Okay? What's the benefit here? We increase the CSAF. The question, how can we increase CSAF? CSAF, compression fraction. Chest compression fraction. So here we get here. How many?
Just compression.
Where is it? Here we have 69. Almost 70%. So we divide the compression time to the total time. How can we increase the CSAF? By minimizing interruptions. The question, what's the interruption that you have? First, ventilation is interruption, am I right? So you have to do it within 10 seconds, go back. And shock. During shock, during analysis, don't touch this interruption. During analysis, don't touch because you analyze your heart rhythm, not the patient. So this is interruption. What else? Check for pulse assessment, this is interruption. So if you're coming for the patient for the first time, don't check it for more than 3 times. Say, are you okay? Say, are you okay? Say, you are okay? You take it more than 1 minute. Check that patient. Only 2 times. Say, are you okay? Are you okay, someone? No response, no sign of alarm, that means this patient doesn't respond. What else? Intubation. Intubation will interrupt chest compression. How many seconds we have?
10 seconds.
10 seconds. So you have to ask the anesthetist to intubate it within 10 seconds. Press, press. Stand by. Stop. 1 and 2 and 3. If he or she failed after 10 seconds, you have to go back for back valve. Ventilate and go back to trial. Okay. So this is for teamwork. We finished. I finished back mask device. We said that you have to seal the mask and look for the chest rise and fall during ventilation. Okay, the 6th team leader, we said leader, the role of the leader to assign the role of the teamwork and determine the course of treatment, and they're going to discuss. We have pre-briefing and debriefing. What is the meaning of pre-briefing? This is the meeting before starting. Will be ventilated, avoid hyperventilation. You have to be cautious about the ventilation. Will be compressor, don't make fracture. You have to prepare your team. And after coding, start discussion during CPR. Why? Because you have to improve the performance during. Maybe somebody they have no course for 4 years, so he's out of date. So you have to update him during discussion. Okay. Compressor. What is the role of compressor? You have to do it high quality CPR and prevent fracture of the wrist. Who will observe the compressor? The CPR coach, who will shock the patient. But the overall is the leader. Okay. Number 4 is AED monitor, CPR coach, and medication. Medication, they're going to give adrenaline epinephrine in hospital. And the leader is going to evaluate everything. You miss your rule, Mom.
Yeah.
One of your rule is to use the stopping watch.
Yeah, I saw it there. Why
But
I saw it there.
once you have no need, once you have this program, because the program is going to evaluate everything, the time, and just recoil, and just compression and ventilation. So we get TSCC, no need. But in the real, you have to have two stopwatch. The one is for total time, and the second is for the chest compression time. At the end, you have to divide compression time into the total time. Okay, for example, if you have the patient stay for 10 minutes in the hospital, so how many percentage will be the minimum to get 6% out of 10 minutes?
Mathematics.
6 minutes. 6 over 10% is 6%. And the mandatory is 80%. So you have to have 8 minutes out of 10 minutes just compression only. So you have only 2 minutes for interruption for ventilation. You get?
Yeah.
So the range between 60 to 80% acceptable for C-safe. So who is the rule? CBAR, the time record. You're going to record the time for chest compression and total time. So you have to have two stopwatch. Really, you have to do it in the hospital.
Yeah, I saw it there.
Yes, yes.
I saw it in the picture.
Yes. So this is a recorder. You record everything. Okay. Communication. Essential effective communication, which will result in successful performance by the multi-rescue team. In this case, that a mistake where to occur, prompt action should be made to stop it from happening, but it should be handled in such manner. Calling the team member should be done by one of the following ways. Steven, you have to call the name. If you forget to say the compressor, but you have to call one professional, nurse, doctor, whatever, and the role compressor. You can name by these three items. Actually, you have to share knowledge during CPR team work, share knowledge, and the way of communication is should be you have to respect each other. Okay, because if you have clashes, personal issue, this will be reflected in your patient. For example, Steve, you are a very bad compressor. Last time how we passed our patient is passed because of you. No, this is not me. This is for Stella. And they are going to shout for each other. What is the result? Patient is passed. So you have to respect and respect the team leader. Sometimes the team leader is shout, but don't shout. Shout for me, I'll shout for you.
Shout for you.
So you have to respect each other. Whenever instruction or orders are given only. So, what is the way of conducting the communication? You have to repeat the message. For example, Stella, members. You will be the leader. So you have to repeat, I will be the leader. That means you get the message. If I say, you will be the leader, but I didn't hear it, then I'm going here and here. Mom, why I'm stop here? I don't know what I'm going to do. What is your rule? You don't. You have to do clear message. Clear message will be the compressor. I will be the compressor for the first 2 minutes. You will be the ventilator. What's your name?
Jeremy.
Jeremy. Jeremy will be the ventilator. Repeat.
And ventilator.
See? So you have to repeat by loop communication. I will assign, then you repeat the message. That means everybody identify this is exactly the rule during the CBR. Debriefing is discussion. Okay? The purpose of debriefing is not to provide feedback on the performance. Is not to provide feedback on the performance of each team member, but rather to assess the performance of the multi-rescuer as a whole team in order to pinpoint their strengths and weakness during the course. Because if you have discussion after, it's good. After the patient pass, what's the benefit? So the discussion should be during, after coding. One, to increase or to optimize the performance of the team. You get? Stephen, more depth, more depth. We forget your name. So debriefing after coding, huh? After coding. Switch role and obligations. Shall we this? Okay, pediatric. For pediatric, we have the same steps. Safety, check for patient response, check for carotid pulse. So carotid for adult and child. For infant, you have to check brachial. You mentioned it, okay? You have to do it 30 to 2 for one single rescue. If it is 2 rescue, you have to do it 15. The reason why we do it 15?
You can the first if you have partner you can just
No. Why we do it 15 too? Not 32. This is by increasing respiratory rate, because if you do it 15, you get 2 rescues. Another 15, you get 4. Okay? So here in 15, you get 4 and 30 chest compression. That's why, because for child, we have more respiratory problem. For adult, it is more cardiac and maybe sometimes hypoglycemia. Okay? Somebody asks me, why 15 and 2? Because we need to increase the ventilation rate for infant. Why? Because the infant and child is more respiratory person. You get? So check surrounding, check victim response, check victim pulse, breathing, and call for activation areas. Assess, check for pulse, and you do high quality. The same sequence, C, A, and B. How many cycles? For high quality, you have 2 inches, the same line, but we said for adult, at least 5. You can more if you have this material. Huh? You have to do it more than 5. But for child, you have to do it 5 centimeters. For adult, at least 5. You get? For child, 5 centimeters, 2 inches. Okay? And cycles are just compression, the 2 breathing for single and 15 to 2. The rate of compression 120. As you mentioned, for 200, you give for 2 rescue, compression to ventilation ratio is 15 to 2. And the rule will be switched as follows. Second rescuer and first rescuer begins. How to assess an infant who has embedded cardiac and respiratory arrest? How to perform high quality CPR? How to assess for infant? This is the infant. You forget that. Child age is from 1 year to puberty. And infant is below 1 year. Okay? Below 1 year is infant. So what's the first step? It's very different. Check for response. Here we check the response good. Baby, no response. What's the next? Check for pulse and breathing. Where we check brachial breathing, not carotid, because we have short neck, short airway. For that, you have to check for brachial. 1 and 2 and 3 and 4 and 5. There is no pulse, no breathing. Call for emergency. But if the child is not witness at that time, what do? You have to start, and after 2 minutes, you can call for emergency. Because we need to start early CPR. If you are not witness, because the oxygen saturation is going down. Okay? So for chest compression, where you put our hand under the nipple line, 2 fingers. I'm alone, you can use finger or thumb. It's up to you. So here we use the finger. Put your hand and look for the feedback. 1, 2, 3, 4, 5, 6, 7, 8, 9. If you have green light too, that's all right. If you are going very fast, you get rushed. It's not okay. If you are very slow, this is one green light. You are very slow. If you are doing like that, it's red. No chest compression. So 2 green light, you are okay. 1, you are not okay. Flash, you are not okay. Red is not okay. You get? You have to make sure that you have good feedback to green light. Slow down. Use your thumb. 1, 2, 3, 4, 5, 6. After 30, open the airway. And here give ventilation. 1 and 2. Go back 5 seconds. I'm alone, huh? If the second respirator came here, what is this? Okay, man, we'll be ventilated. Yeah. So I'm the first, you take on standing because you covered. I check the response, it will be here, ventilated. Baby, baby, wait. No response.
I will check first.
Second step.
Baliktad.
Baliktad. I will check the, wait. 1 and 2 and 3 and 4 and 5. There is no pass on this. You have to activate the EMS. Call for 911. I will be the compressor. How many? 15. Because we have 2 receivers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15. Give. Open the airway.
Sabi ko nga eh, tipis ko eh.
See any. See your mask. Okay. Second one. How many cycles? Actually, we need 10 cycles. Because we are doing 15 and 2. 15 and 2. Okay. For after 10 cycles, she will check the pulse, no breathing. So I give ventilator and she will be compressed.
Oh, ano ba naman ang trabaho ko?
Do it no.
Ay, sige yan.
How many? Yeah, do it.
1, 2,
Fast.
3, 4, 5.
Fast. Okay. More. This is 20. You have to count. 1 and 2. Count. 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1 and 2 and 3. How many cycles? How many cycles? 10 cycles. After 10 cycles, check pulse, check breathing, and respond. The baby is alert, conscious. Left lateral position. Tapos na. You are doing well. Okay. This, you are alone. How can you do it? CPR for infant. Yes. First, safety.
For the
Check the response.
hey, are you okay?
Okay. And
Then check for the circulation.
There you go.
Yeah.
then,
No pulse or no circulation.
yes.
Start CPR.
Okay. Do it. Either use thumb or finger. How many chest? Excellent. Within 10 seconds. 1 and 2. Go back. And then go. How many cycles?
10.
10. Okay, you are coming as second respirator. Come here. You will be the ventilator. I will be the compressor. How many chest compression?
15.
15. Give ventilation. Give. 2. Go. Count.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3,
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 11.
Yes.
1, 2, 3, 4, 5, 6.
How many cycles?
8, 9, 11,
10 cycles.
13, 14, 15.
15 بعدين
15 نفسين 10 مرات. Okay, now we finish 10 cycles. What do you do?
Recess.
The ventilator will assess pulse and breathing. Now the baby is pulse without breathing.
Press to the end.
There is pulse, no need for compression.
No need for the press, just.
So how many the frequency? 2 to 3.
2 to 3.
Every 2 or every 3 seconds we give. For adult, every 6. For infant child, every 2 to 3. So how many press per minute? 20 to 30. So you can do it. 1, give, count. 1 and 2. Loud.
1, 2.
1 and.
1 and 2. 1 and 2.
History.
1 and 2 and 3.
If you say, this is the first one, huh? This is the first. 1 and 2. 1 and 2. 1 and 2 and 3. So with the number you have to press. If you say 1 and 2, this is 3. Because you have that, right? 1 and 2. 1 and 2. 1 and 2 and 3. You get? Because if you say 1, 2, this is only 1 second.
Yes. 1 and 2.
Yes.
1 and 2. 1 and 2 and 3.
Excellent. Here we are. The rate will be 20 to 30. After 2 minutes, meanwhile, you have to check again for pulse and breath. Now you have breathing and pulse. What do you do? Recovery left side, recovery position. Here we are. Excellent. Get
Sir, how is the
what? Under the level 1. This is the level 1 under.
Here.
Here.
Ah.
You have to sleep it. The fingers here is not identical, huh? So you have to do it like that. Very good. Yes? Next, please. To respire. First, check for response. Foot. Foot response. Okay.
Check pulse. There's no pulse, need for help, then start breathing.
Okay. How many? Chest compression. How many?
30.
15.
I 15.
No.
Yeah, 15 is 1, 2, 5, 6.
If there is somebody activate EMS for emergency. Nobody, huh? No one. Nobody will know you. You have a child. You see CPR. So you have, don't forget to call for emergency. Because you are waiting for the ambulance. The ambulance is the hospital. Patay na. Papatay na. Yes. Mom, see the mask? You have to do it gentle. Be serious. This is your C, E, chest right and front. Do it. See the mask, C and E. For infant, don't give the big volume. It should be small buff, huh? Don't hyperextend the neck. It should be minimum. The middle of the level of the chest. Don't hyperextension. If you do it hyperextension, you close the airway. Because for infant, you have short airway. Do it. Keep the mask.
Lagi naka-record pa yun.
Ay, naka-record nga.
Take a rest. Sleep for someone's chasing you. Kung pumayag ako na sila pumunta dito, di ako pwede mag-reception ng ilang
Well, asan ba yung head nurse natin?
Ini ada dari
Itu tadi.
What time is it? You. Me one. Wala naman ang klase dyan. Ayun, malas na.
ആദ്യമേ അവിടെ മലയാളം എണ്ണിയാ മതിയായിരുന്നു വെറുതെ ഇംഗ്ലീഷ് എണ്ണിയിട്ടുണ്ട് തെറ്റിപ്പോയത് ഡോക്ടർ
Sorry. Okay, you finished? 30 for more rescue and 52 for twist.
Mag-isa na naman ako mama niya.
You said you're
Yes.
I don't know if you want It's okay, you're not enrolled here, sir.
You want me? I'm thinking at evening.
Okay, have a seat. This is the last point. Number 2 point. Special consideration. As you mentioned, if you have advanced airway, the compression will be continuous and breathing will be 6 breathing. 1 breath every 6. For all ages, child, infant, and adult. If there is pulse, no breathing. For adult, 1 every 6. For infant and child, 2 to 3. 20 to 30 per minute. Okay, if you have overdose of opioid, you know the opioid, morphine, morphine, overdose will depress the respiratory system. What do you do? Give antidote. What's antidote for opioid? Naloxone. So give naloxone antidote and give raising every 6 1 risk degrees for all ages. You get? Okay, the last special consideration is for pregnant women. How we do CPR for pregnant in the last trimester? They are coming with big abdomen. So here the problem, we have 2 patients. And the other problem is the position. The only position for CPR is supine. And if you put the woman to supine, the baby will press and stop the refill of the venous retail. So how do? You have to push the left side position low. Sorry, this is the right. You have to push to the left side. So we display the infant and you can push the uterus to the left side. At that time, you can have access to the venous retail and you can do chest compression. Actually, one to push to the one on the left side and the other continue chest compression. So if somebody asks you, what do you do for pregnant? The last trimester, both in supine left lateral position. You get? Okay. For obstruction, the choking, actually we have 2 types. Either we have partial obstruction or total. Okay. What do you do for partial obstruction? Nothing. If there is start to child or infant or adult. So usually able to speak, cry, and cough or breathe. There is no difference. Okay, so you have to encourage the patient or encourage the child to cough. If it is complete obstruction, you have to use one, two, three, 5. Then see the following one. If you can release the following, if the child becomes unconscious, what do you do? Go down, see there. So again, partial obstruction, patient stuffing, you have to encourage the patient on, no intervention. If it is complete, the child have complete either it is conscious or unconscious. If it is conscious, you have to do Heimlich maneuver. If he or she is unconscious, you have to do CPR. You get? This is for child and for adults. This is a sign of universal obstruction. So if we press it with the umbilical and chest bone, this is the correct position of the pressure. Here. Don't press on the chest only for 2 patients. For pregnant and for obese, not alone. If it's very big, you cannot catch the abdomen. So you have to do it chest. And if you have pregnant, if you press the abdomen, you kill the baby. So you have to press. They are eating a lot, the baby. They have five meals. Huh? So you have to press chest, okay? And You have to do it continuous compression until you relieve the foreign body. This is pregnant, you have to do it chest. Gives chest thrust, huh? Not abdomen, chest. Okay, if you have child, or if you have infant blowing here, what do you do? First, you have to see if he is conscious or unconscious. If he is conscious, you have to do back slap 5 and chest thrust 5. 5, 5. You get? And it's better to sit down in the chair. How we handle this is you handle in the foot. Put your arm here and turn it to the back. First step, the back snap. You have to do it down the head, open the airway. See here. Open the airway between two shoulder fibers. 1, 2, 3, 4, 5. Then chest thrust. 1, 2, 3, 4, 5. If you get, you can use finger if you can see the follicle. Can sweep it out. Okay, so 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Then you can sweep if you can see the follicle. So 5, 5. If he is or she became unconscious, you have to put that stuff CVR. Just compression ventilation. But if there is foreign body, how can you give ventilation? You block. So what do you do? After chest compression, if you can do it, okay. If you cannot do it, you have to reposition the head. To manipulate the foreign body, the left side. Okay, mom.
Yes. Ay, kayo na.
Yes, mom. Sir. Yes. Back down, chest thrust.
Ano, hindi kaya ako makakasala rin.
Yes, mom. Yes.
Then,
Down. Here. So outside. 1, outside. Yes. 5, hold it.
then check.
No, don't check. Just 5, 5. Head should be down. This gravity is easy to remove. 1, 2, 3, 4, 5. You can see the foreign body, use small finger, sweep it out. Okay, next please. Back slap 5, chest compression 5. 1, 2, 3, 4, 5. Next 5.
And I can see the foreign body, fingers please.
Okay. Back slap 5, chest compression 5.
See the foreign body?
Yes, ma'am? Good.
Ako na stress.
Ako 11.
Yes.
Hindi makakasala kasi ano naman, alam naman nila ko lang.
Isa sabihin kay Hila or
May system si
Alam naman nila.
No. The leg should be between you. Open the airway.
nakasala rin na nga,
Head down.
nakasala rin pa sa bayan.
That's up. 1, 2, 3, 4, 5. Excellent.
Ng peg. Kasuman mo,
Extend ka na lang sa
babalik
Hindi,
uwi ako,
mag-extend
babalik
ka na
ako.
sa akin.
Hindi, uwi ako, babalik ako.
Okay. Back slap 5. Between two shoulder. Open the airway. Open the airway. 3, 4, 5. Okay. 1, 2, 3. Excellent. If you can see, if you shock it, become unconscious, you have to start CPR. Your baby. Good. Head down. 1, 2, 3, 4, 5. You can see, you can see it very small finger. For adult, you can use the big finger for adult. Okay. Back snap, 5. Open the airway. Here. 1, 2, 3, 4, 5. And the chest, thrust, 5. Okay.
Come out.
Okay. So if you go back for, as we mentioned, if you have advanced airway for adult, you have to give one breath every 6 and infant one every 2 to 3. Okay. CPR for pregnant, you have to do it manual left uterine or uterine displacement to the left side. So supine left lateral position. Yeah, this is as we have. If you are in the left side, you have to push like that. If you're in the right side, you have to push with one hand to the left side. So in both cases, you have to push the uterus to the left side. What is the venous retain? The venous coming under the uterus. Yeah. What is the vein? Inferior vena cava. We have two axes. In the upper we have superior vena cava, and under we have inferior vena cava. So the baby will press the inferior vena cava. So there is no venous retain coming from the lower extremities. Opioid dose we gave naloxone, and we start 6-period ventilation. How we administer naloxone? Intranasal, intramuscular, and intravenous. Okay, we have to revise steps. First, check for sensitivity, adult. Second, check for response. If there is no response, shout what happened. Check for pulse spacing and activate EMS 911. Start early CPR within 10 minutes and shock the patient if you get the machine. If you don't have the machine, you have to continue CPR. If we have CPR and the AED is high, what do? One to continue CPR and the other using AED. Okay, you have to use it both at the same time. But the priority is for defibrillation. The sequence CAB. If you get a D, you have to have D, C, A, and B. Okay, how many cycles? 2 minutes. 5 seconds, 2 minutes. What do you do after 2 minutes? Assess and according the response. Breathing response, recover. There is no, you have to continue. If there is pulse without breathing, you have to give only ventilation. For adult, every 6, for infant, every 2 to 3. The steps for the machine, AED, 4. First, operate on, turn on. Second, Jimmy, attach guard. For adult, left and right. For infant, front and back. And the third one, the third step. Analysis. We have 2 options, shockable or unshockable. If it is shockable, give shock and resume CPR 5 cycles. If not shockable resume, you have to continue only CPR. The shockable common is VF. The unshockable is assist. So we have power on, attach guard, analysis, and shock. Precaution. Hair, shave it. There is water or sweating, you have to dryness. And if you have a pacemaker, medical part, you have to leave it and prevent attach over the pacemaker. Excellent. For infant and child CPR, if you have 1 rescue single, you have to do it 32. If you have 2 rescue, you have to do 15 and 2. 5 cycles reassess pulse, breathing, and response. Where we check the pulse? Rated. For adult? Pulse, for adult, carotid pulse. For infant, brachial. Okay, high quality via
Chest.
depth, 5, chest release, speed of compression, 100, 120. Excellent. And minimize interruption less than 10 seconds between each cycle. How many cycles? 5 cycles. Excellent. For pregnant, how you do CPR? Push supine and left lateral fusion, left uterus to the left side. Opioid overdose, 2 steps. Give antidote naloxone and give breathing every 6 seconds for adults. And for infant, 2 to 3. You get? You ready? Excellent. Thank you. So please go to your account.
Ayun, tumawag na yung
Give to her. No, I have a